In this session of the Pediatric Emergency Medicine Fellows Research Design course, we will review the second half of the course. Course Review 2 includes the topics highlighted in red. The first topic is writing a research protocol for IRB submission. In general, research is defined as the use of human subjects in a systematic investigation to produce generalizable knowledge. The IRB is responsible for ensuring that research meets human subjects' requirements. The IRB is looking for a well-written and rigorous protocol. Sound study design should minimize risk to subjects and ensure that risks are reasonable in relationship to benefits. Subject selection should be equitable. The informed consent, assent, and authorization process should be detailed. Methods to ensure data safety, protect privacy and confidentiality, and to protect vulnerable subjects are essential. These are the elements of a research protocol using the NYU template for an observational study. There are also templates for interventional clinical trials and interventional behavioral studies. The best way to start writing a new protocol is to review one that has successfully gone through the IRB review process. The protocol is the plan for how you will conduct your research project. Writing the purpose of the study is approached in the same manner as writing an introduction to a research manuscript. Clearly state the problem. A focused literature review should discuss what is known and unknown about the research topic. This sets up your study question, objectives, and hypothesis. The study design should explain how the hypothesis will be addressed and include principal variables and outcomes. The enrollment criteria, both inclusion and exclusion criteria, define the study population. The number of patients to be enrolled should be based on the selected effect size and a sample size determination. The gender, age, racial, and ethnic origin, and the inclusion of vulnerable subjects should be specified. Writing the methods and procedures section of the research protocol is analogous to writing the methods section in a manuscript. Writing a good research protocol completes the background and methods sections of your manuscript. Procedures, tests, and interventions should be clearly defined. It is essential to distinguish between research interventions and standard interventions. For example, a standard intervention for dehydration may be placement of an intravenous catheter and the administration of fluids. The research intervention may be the type or volume of fluids administered. A complete analytic plan includes sample size determination, demographic data, and the planned approach to inferential statistics for the primary and secondary outcomes. The analytic plan can serve as an outline for the results section of your manuscript. The consent and authorization process embody the ethical principles of respect for persons, beneficence, non-malfeasance, and justice. Consent refers to an adult or a legal representative agreeing to study participation. Assent refers to a child of decision-making age agreeing to study participation. Authorization refers to permission to collect protected health information. It is very important to be able to distinguish these three concepts. The next two slides present the elements of a full written consent form from the NYU IRB consent template. The questions are written and answered from a participant's perspective. The consent must explicitly state that the subject is participating in a research project. Many of the sections of the research protocol are repeated in the consent document at a level that a layperson can understand. This is the remainder of the required elements of informed consent. A detailed discussion of each of these elements is beyond the scope of this talk. The IRB considers certain groups as vulnerable in the consent process and warrant additional protections. These groups are at risk from participating in the study. They may be at higher risk than normal from study participation, for example, pregnant patients, not comprehend the risk of participating in the study, children and those with diminished capacity, or at risk for coercion to participate in the study, prisoners or students. The groups relevant to our research are children, employees, and students. Employees include faculty and nurses. Students include medical students, residents, and fellows. Consent is the agreement of an adult to participate in a study. Assent is the agreement of a child to participate in a study. For a child to participate in a study, both parental permission, consent, and assent of the child are required if the child is of decision-making age and capacity. The capacity to assent should be evaluated on a case-by-case basis. Separate assent documents must be prepared for each age category and reading level, usually in the three broad age groups above. HIPAA refers to the Health Insurance Portability and Accountability Act. Protected health information, or PHI, is defined as any information related to the past, present, or future health of an individual or payment for that care. Individually identifiable PHI includes demographics and any information that can be used to identify an individual. A de-identified dataset cannot include any of the following identifying information. The next topic is writing a research proposal for grant funding. There are many potential sources of funding. These include federal sources, such as the NIH or the Maternal Child Health Bureau, private sources of funding that may be nonprofit foundations, such as the American Heart Association, or philanthropic organizations, such as Kids of NYU. Private sources may also include for-profit sources, such as pharmaceutical or device manufacturers. Internal sources may be universities or departments, and private donors may also be a funding source. The NIH is the principal source of federal funding for clinical research, with a budget of $47 billion in 2024, 83% of which goes to extramural research. The NIH is divided into ICOs, or institutes, centers, and offices. Each of the ICOs have different missions, priorities, and budgets. There are 27 institutes and centers. Institutes and centers are the primary research units. Offices manage the overall operation of the NIH. After the primary review, the bottom 50% are unscored. These are classified as not discussed or not recommended for consideration. The remaining 50% undergo secondary review. The outcomes of secondary review include approved and transferred, deferred, and not funded. Overall, 20% or 1 in 5 new research grant proposals are accepted. The process can take up to 13 to 15 months from planning to receiving funding. This includes planning and writing and the review process. Results of the initial review can take 4 months, and if approved, funds are received 3 to 5 months later. This is an overview of a research plan. From an investigator perspective, the research plan should answer the questions: what are you proposing? Why is it important? And how you will accomplish it? From a reviewer's perspective, they ask, are the aims logical and feasible? Is the hypothesis sound and important? Are potential problems understood? And can you perform the study and analyze the data? A complete grant application includes an abstract, a research plan, and a budget. The budget distinguishes it from a research protocol sent to the IRB for approval and comment. The abstract may be the only thing that most reviewers read. New investigators should develop an area of expertise in non-funded projects and obtain advanced research training. Review grants that have been successful. Start small and get help early. Surround yourself with experienced researchers and utilize institutional resources. Up until now, we have primarily discussed the NIH, but there are many sources of federal funding that may be an appropriate funding source depending on your area of research focus. The Department of Transportation funds traffic safety research. The Department of Justice funds adolescent violence research. The Department of Defense funds disaster preparedness research. The Environmental Protection Agency funds toxicology research. And the Consumer Product Safety Commission funds injury prevention research. These are just a few examples. The next topic is data collection. There are many potential sources of data. You may collect new data from surveys or questionnaires or with data collection forms. Subjects complete surveys and questionnaires. The investigator completes data collection forms based on observations, assessments, or by interviewing subjects. You can also collect existing data from the electronic medical record and administrative and clinical databases. Clinical databases such as the Pediatric Trauma Registry and the Pediatric Airway Registry are more likely to contain the information that you are looking for than the electronic medical record or administrative databases. Questionnaires and surveys are generally efficient, uniform, less expensive, and require less time to complete. Interviews can get at more complex issues, are able to provide guidance, prompts, and explanations as needed, and ensure completeness but take more resources to complete. In the next group of slides, we'll review the use of different types of questions and pitfalls in question design. Open-ended questions are useful when respondents' own words are important. They may reveal unpredicted responses. They can be used in an exploratory phase of question development. They require more time to complete and provide more subjective responses. They require qualitative methods for coding and interpretation. For example, what habits do you believe increase a person's chance of having a heart attack? Closed-ended questions are quick and easy to complete. The list of possible responses helps to clarify the question. It can be used to develop scores and require quantitative methods to analyze and interpret. For example, which of the following do you think most increases a person's chance of having a heart attack? Choose one: smoking, obesity, drinking alcohol, stress, or others. Describe. Questions should be clear and avoid technical jargon. An example of an unclear question is, how much exercise do you usually get? A clearer question would be, during a typical week, how many hours do you spend exercising? An example of a question that uses technical jargon is, what medications can you get over the counter? A question that uses more common language would be, what medications can you get without a doctor's prescription? Avoid questions that include loaded or judgmental words and stereotypes. An example of a poor question is, how often do you drink too much alcohol? A better question is, how often do you drink more than 5 drinks? Use a neutral approach to obtain truthful answers. An example of a poor question is, people sometimes do not follow their doctor's instructions. Do you ever not take your medications? A better question is, people sometimes forget to take the medication their doctors prescribe. Do you ever not take your medications? Avoid double-barrel questions. These are questions that include and or. For example, do you like peas and carrots? How do I answer this question if I like peas but don't like carrots, or like carrots but don't like peas? Instead, split a double-barrel question into separate questions. Do you like peas? Do you like carrots? Do you like peas and carrots together? Avoid hidden assumptions in questions. For example, how often have you felt I could not shake off the blues even with help from a family member? This question does not apply to everyone. It assumes that the respondent has depressive episodes and that a family is both available and willing to give help. Complex constructs require more items to assess. For example, how satisfied are you with the fellowship simulation curriculum? There are many aspects of the fellowship simulation curriculum. How satisfied are you with the frequency of the simulation sessions? How satisfied are you with the cases used? How satisfied are you with the debriefings? The responses to 1A, 1B, and 1C could then be used to create a composite score. Likert scales are also commonly used to quantify attitudes and behaviors in response to a question. Likert scales provide a list of possible responses. The response categories are selected by the investigator. 7 to 9 categories are recommended for fine delineation or more granularity. 3 to 5 categories are recommended for broad delineation and less granularity. Odd number scales include a central or neutral category. Some responders don't have strong opinions. Even number scales don't include a central neutral category. They force responders to choose a direction of response. Tips for optimal survey design include keep it short, less than 15 to 20 minutes, and simple. Describe your goals and hypotheses. Avoid jargon and acronyms. Start broad, then specific, and end with demographic data. Use validated scales rather than yes-no responses to obtain a broader range of responses. Pilot test for duration and confusing items before implementation. Tips for optimal interviews include pre-train the interviewers. Use a script and uniform wording and nonverbal signals. Read questions verbatim. Use common spoken English. Probing or prompting for further responses should be standardized. The next topic is data management. There are many areas that can be classified as data management. The data that we collect from whatever source becomes our data set. Creating a data set requires many steps. This includes the creation of a data dictionary. The data dictionary clearly defines each variable. This includes coding and transforming each variable, ensuring accurate data entry, cleaning the data set, and creating a final data set for analysis. Protocol elements involving data security and storage include a complete analytic plan with sample size determination. Conducting a study with insufficient power is unethical. Subjects are put at risk without potential benefit. And securing the data and plans to protect privacy and confidentiality. Most data capture is electronic. Web-based data entry is easy to compile and enter and avoids transcription errors. Answers are checked automatically, can identify out-of-range values, can force responses, and make branching questions easier to follow. NYU's version of Qualtrics is required for surveys. REDCap is the preferred electronic tool for data capture. Investigators are responsible for maintaining the data for at least 3 years after analysis, and for at least 6 years if it contains protected health information. Investigators are also responsible for providing access to the data for research audits. The next topic is presenting study results in posters and manuscripts. It is important to understand when national conferences occur and plan your research project to anticipate submission deadlines. These conferences can be divided into pediatric-focused or emergency medicine-focused. In pediatrics, there is a Pediatric Academic Society and the American Academy of Pediatrics. In emergency medicine, there is the Society for Academic Emergency Medicine and the American College of Emergency Physicians. Pediatric emergency medicine has a home in both. Research presentations are classified as posters or platform presentations. There's a bit of a hierarchy, with platform presentations being more prestigious than posters. Platform presentations are an opportunity to present your study in slide format verbally to an audience of peers, followed by questions. Posters are attached to a board or wall. During assigned times, you stand near your poster while attendees walk around and ask you questions and comment on your work. Recently, there's been a hybrid model of verbally presenting posters as well. For example, the Pediatric Academic Societies include an oral poster symposium. 10 to 12 posters are grouped by topic. Following a 30-minute viewing period, short oral presentations and a discussion period with questions from the audience is chaired by the session moderator. This is a sample poster layout. The title banner with authors and institution name and logo is on the top. The poster is divided into columns representing the introduction, methods, results, and conclusions. The arrows follow the progress of the content from beginning to end. This is that sample poster from the previous slide with content for each slide panel. Essentially, it follows the same format you would in writing a manuscript. Their introduction identifies the problem, what is known and what is unknown about the problem, and your goals and hypothesis. The methods section describes how you intend to answer your research question. The methods also include a description of the subjects, setting, and study design, definitions of the predictors and outcomes, as well as potential confounders, and your analysis plan. The results column includes a description of the study population and the results for the primary and secondary outcomes, preferably in graphic form. The conclusions column includes the limitations of your study, your conclusions, and potential implications. The panel should tell a convincing story in the order of hypothesis, to methods, to results, to conclusions. During the poster viewing session, be a good host. Greet and introduce yourself and your poster. Offer to succinctly walk them through the poster. Take the opportunity to network and collaborate. Talk to your neighbors. Look for session chairs and invited guests. Identify other researchers in your area of research. Most platform presentations require a conflict of interest statement, even if there are no conflicts to disclose. Presentations are typically 10 minutes, followed by a 5-minute question and answer period. Allot 45 to 60 seconds for each slide. In a 10-minute presentation, that means a total of 10 to 14 total slides. Prepare additional slides to address anticipated questions. The introduction sets the stage for your research question. What is the problem and why is it relevant? What is known and unknown about the problem in the medical literature? What question do you intend to answer? Use the PICO or PICOD format to structure your research question. What is your study hypothesis? The hypotheses are the anticipated answer to your research question. The presentation should follow a logical sequence for each of the goals and hypotheses. Goals should be linked to the methods that are linked to the results that are linked to the conclusions. Speak slowly and clearly. If you have too many slides, you will feel rushed. Face the audience, not the computer or slides. Be aware of your speech characteristics such as tone, inflection, pitch, volume, rate, likes, and ums. Be aware of nonverbal behavior such as posture, gestures, eye contact, facial expression, pacing, and fidgets. Record a video of the presentation to review your speech characteristics and nonverbal behaviors. You cannot fix the problems if you're not aware of them. When presenting graphs, figures, or tables, orient the listener. For example, the y-axis represents mortality. The x-axis represents the time in years. Practice several times while timing each presentation. Cut material ensure consistently on time. Find a sympathetic group who will listen and provide honest critique. This should include at least one person who is not familiar with your research. The first pass should focus on content, order, and clarity. The second pass should focus on form and flow, and again, clarity. What questions did the group ask, and how would you answer them? The next topic is manuscript submission. The goals of the peer review process are to review potential conflicts of interest, determine the validity of your study, determine if it is appropriate to the journal's target audience, and to improve the quality of the manuscript prior to publication. This is an overview of the peer review process. An author submits their manuscript to a journal. It is screened by an editorial assistant who makes an assessment. The manuscript can be sent to reviewers or rejected without review. The reviewers prepare comments and recommendations for the author to address. The author revises the manuscript, and if the revisions are accepted, the manuscript undergoes editorial board assessment. The editorial board can accept the manuscript and send it to the publisher, or reject the manuscript. This is a simplified version of the peer review process. Notice that the arrows are bidirectional, except for after the manuscript is sent to the publisher. This can become a frustrating iterative process. In selecting a journal, review recent issues to determine the focus of the journal and review the author's instructions for guidance on their target audience. Consider whether you want a subspecialty journal such as Pediatric Emergency Care or a general journal such as Pediatrics or Annals of Emergency Medicine. Consult with those with more experience in the process. Determine which journals your references come from. The time frame may also affect your journal selection. If you have lots of time, submit high and can always resubmit to moderate to lower journals. If you are short on time, submit to a moderate to low journal for a better chance at initial acceptance. Scientific writing is clear and precise. Use simple, short sentences with an active voice. Avoid jargon and excessive abbreviations. Writing is an iterative process of feedback and revision. The presentation should follow a logical sequence for each of the goals and hypotheses. Goals should be linked to the methods that are linked to the results that are linked to the conclusions. The Equator Network is a great source of reporting guidelines for most type of study designs. Many journals are requiring the completion and submission of these guideline forms or checklists. The User's Guide to the Medical Literature is another resource. It is helpful to review the criteria by which your article will be critically appraised. Authorship entails credit to the innovation and contribution of researchers, defines who is responsible for the quality, accuracy, and ethics of the work, who to turn to for answers to questions about details not provided in the manuscript or about the integrity of the data. This is the International Committee of Medical Journal Editors' criteria for authorship. An author needs to complete at least one of the 5 items listed in the first criterion. These are substantial contributions to the conception or design or acquisition of data or analysis of data or the interpretation of data. In addition to meeting criterion 1, an author must meet criteria 2, 3, and 4. So meeting criteria 1 and drafting the work or revising it critically for important intellectual content, and final approval of the version to be published, and agreement to be accountable for all aspects of the work and ensuring that questions related to the accuracy or integrity of any part of the work are appropriately investigated and resolved. Those not meeting all 4 criteria for authorships can be acknowledged in the manuscript. Those acknowledged are thanked with their written permission. This may include anyone providing support or advice, such as consultants, for example, statisticians and questionnaire designers. Data collectors, patient enrollers, and mentors may also be acknowledged. Common causes of conflicts of interest include sources of outside funding and financial interest in any products or company. Other sources of potential conflicts of interest to consider are included on the slide. The last topic in Course Review 2 is research ethics. As a reminder, we have already discussed human subjects protections in submitting a research protocol to the IRB and publication ethics in this session on manuscript submission. Federal regulations seek to protect human subjects. These ethical principles are based on the Nuremberg Code and Declaration of Helsinki in response to the atrocities committed during World War II, and the Belmont Report in response to the Tuskegee study conducted by the U.S. Public Health Service in which Black men with syphilis were left untreated to follow disease progression. These 3 documents are responsible for the human subjects research protections that are part of the IRB review and consent process. The ethical principles that guide human subjects research include respect for persons, beneficence to do good and non-malfeasance to do not harm, and justice. Beneficence or do good is dependent on a valid study design, that is, a study design that will answer the research question without bias. Investigators should minimize harm, including monitoring for adverse events and maximizing benefits. This includes physical, psychological, and financial harms and breaches of confidentiality. Research subjects should not be disadvantaged by research participation. The concept of clinical equipoise indicates that there is uncertainty about the comparative therapeutic merits of each arm of a clinical trial, and that the likelihood of benefit from an investigational treatment is at least as good as the current accepted treatment. An example of non-malfeasance or do not harm is not conducting placebo-controlled pain studies when adequate treatment for pain already exists. Justice indicates that the benefits and burdens of research are fairly distributed to all groups who could benefit from the research. This means equitable subject selection and excluding patients at high risk of harm. This manifests in the study recruitment process and enrollment criteria. Respect for persons is to acknowledge their autonomy and the right to understand and make decisions in their best interest. This manifests itself in the informed consent process. The informed consent process requires additional protections for vulnerable populations who may be at increased risk from participation, have diminished capacity to make decisions, or feel coerced into participation. Respect for persons also includes the subject's right to privacy and confidentiality. On to our research ethics checklists. This is the ethics checklist for the research question. Review all pertinent citations to modify the study hypothesis and limit duplication. Use a research hypothesis that asks a relevant, answerable question. Use clearly defined, clinically relevant, and patient-oriented outcome measures. Ensure that the results are generalizable and practical to implement. This is a methodology checklist. Include all potentially relevant independent variables and plan for relevant subgroup analyses. Utilize appropriate techniques to limit bias, such as randomization, blinding, and intention to treat. Use patient-oriented resources. Use validated measurement tools when possible. This is the writing a research protocol checklist. Disclose all potential conflicts of interest. Do not engage in contracts that limit investigators' rights to data or publication. Research funds should be utilized only for legitimate, approved research expenses. This is the enrolling patients checklist. Enrollment should not be initiated until IRB approval. Strictly adhere to inclusion and exclusion criteria. Obtain consent and assent and authorization in an honest, uncoerced manner. All data should be handled in a confidential manner. This is the data analysis checklist. Complete a sample size determination or power analysis to ensure that the study results are clinically and statistically significant. Utilize a pre-planned statistical analysis based solely on the research hypothesis. Avoid fabrications, falsifications, or misrepresentation of data. Present all results, including negative ones. The checklist for manuscript submission includes: do not represent others' intellectual property. Adhere to authorship guidelines. Include appropriate acknowledgments and obtain required permissions. Ensure the right to publish from private industry. And only submit the manuscript to one journal at a time. The next session in the Pediatric Emergency Medicine Fellows Research Design course is the review of the course examination.